Hello friend, welcome to my channel 5 Minute Pediatric. Few days back I have posted question related to these two figures. So you have to identify these two figures and give two example for this. The condition A, what we called Genu valgum or Genu valgus. Here you can see that both the knee is touching each other, that is knocking each other. So we call knock knee. Here in Genu valgum, both the medial condyle of knee touching each other, while the medial malleoli, if it is more than 5 centimeter gap is there, then it is pathological. And up to 6 year and 15 degree of valgum is normal. So you have to know about this condition, because up to 6 year and 15 degrees normal. Beyond 6 year and more than 15 degree, it is always pathological and you have to go for surgical correction. In figure B, we can see that both the condyle are widely separated. So this condition is called Genu varum. The distance should be more than 10 centimeter for calling it is pathological. Beyond 2 year of age, it is pathological, but if it is less than 2 year of age, it is considered to be physiological. Genu varum, the distance should be more than 10 centimeter, but it is intercondylar distance. But in case of Genu valgum, intermalleolar distance should be more than 5 centimeter. So Genu valgum is found mostly in Rickets, while Genu varum is found in case of Rickets, achondroplasia and Blount's disease. These two questions are frequently asked in NEET PG entrance examination, along with OSCE, mostly asked. Okay, hope you enjoyed this video. Kindly like, subscribe and follow my channel. Thanks for watching.